Hey guys, welcome back to my channel. If you follow me on Instagram, you may have seen that I recently announced I'm currently 13 weeks pregnant in my second trimester. And pregnancy is a very exciting, unique, and sometimes anxious-provoking time, especially if you are a first-time mom. A lot of changes are happening with our body and skin. So I thought I would take this opportunity and do a series of videos sharing with you guys some of the normal changes our skin goes through during pregnancy, talk about some of the common skin concerns during pregnancy and how to safely address them, as well as share with you my updated skincare routine. My name is Dr. Jenny Liu. I'm a board-certified dermatologist, and I love to talk about all things skin and skincare related, as well as hair and nail related topics. So this is my second pregnancy, and it's amazing, even though it's not the first time around, how quickly you forget the changes your body and skin goes through. This time around, I have to say, overall pregnancy-wise, I'm a little bit older, but certainly the symptoms have been a lot more severe, especially with the fatigue and the nausea. Now, skin changes, it's been similar. I remember my last pregnancy, I had a little bit of acne in the beginning, and I broke out in hives quite a bit, especially on my face, and I'm certainly experiencing it this time around. Now, keep in mind, everyone is different, and every pregnancy is different. One pregnancy, you may experience a lot of acne, and the next one, your skin can be very, very clear. The one thing I really liked during pregnancy last time around was that at least into my second trimester, third trimester, and postpartum, I had zero acne and I had no migraines. So certainly I'm hoping it would be similar this time around, but I have this time though, with my second pregnancy, been experiencing a lot more breakouts, and my skin has gotten super sensitive all of a sudden, where a lot of products would just burn on my skin. And certainly I'm not going overboard by any means with skincare products. I don't think that wearing masks have been helpful, but my skin has been a lot more sensitive. The redness around the folds of my face have been more accentuated. During pregnancy, certainly our body is going through so many changes. Hormonal changes, immunologic changes, and vascular changes. All these changes that are very much necessary for us to grow a new human in our body. If anything, one thing I think is helpful is just giving yourself some time and grace, understanding that you are growing a new human in your body. And so, it can be frustrating, especially if you are experiencing concerns of your skin for the first time that has never occurred. Certainly understand that this is normal, and for most women, it is temporary. So I'm going to break down this video into sections. Common things that we see with our skin during pregnancy, whether it's due to the physiologic changes of our skin as the baby's growing, or due to immunologic and hormonal changes. I also want to address some of the common concerns like acne, rosacea, as well as common rashes that we see and common benign growths. First and foremost, let's talk about the skin changes as our skin stretches. And the first thing that comes to mind that a lot of women experience is stretch marks, commonly seen in the second, third trimester as the baby is growing on the abdomen, the thighs, and sometimes some women will even get it on their breast and arms. Now, these stretch marks often will look red in nature, and then over time will become more whitish in appearance. We actually don't know why stretch marks occur. We think it has to do with a sudden disruption of collagen due to the quick changes that the skin is going through as it's accommodating the new growing baby. Hormones may also play a role. Now, as far as risk factors for getting stretch marks, it includes a family history of stretch marks. So certainly genetics can play a role. And keep in mind that everyone is different. Every pregnancy is different. The other thing that has been seen is a rapid onset of weight gain that is associated. And we really do think it's really due to the quick changes, the really rapid change in weight gain that seems to play a role. So certainly there are some things that we can do as expecting moms, is making sure that we are getting the weight appropriately and trying to minimize those rapid changes in weight that can really contribute. Now, there are a lot of products out there on the market that are supposedly helpful at preventing stretch marks, but I'll just tell you, there's really lack of evidence that anything works in preventing stretch marks. As far as like cream-wise, oils, vitamin E oil, almond oil, what have you, really haven't been shown to be effective. So really the most important thing is just to keep your skin healthy and hydrated by using a moisturizer, whatever moisturizer of choice, and making sure that you're applying it to your body daily. The only thing that has been shown and has some evidence for helping to minimize the appearance of stretch marks is a Centella Asiatica derived cream. So you guys are probably really familiar with Centella, very popular Asian K-beauty ingredient that has calming and soothing and wound healing properties. I'm not just talking about any Centella based cream that you find on the market, but the specific one that actually has been studied in clinical trials goes by the name Truffle Lasting Cream. Now, unfortunately, I'm actually not aware of where you can purchase this. I certainly have found this cream on Amazon, but of all the topical creams that have been studied, this one has been shown when applied 1 to 2 times daily at the 12th week of pregnancy may decrease the incidence of stretch marks. Looking at the ingredients, this cream contains Centella extract, vitamin E, hydrogen elastin derived peptides. So it's really hard to say, is it truly the Centella or the proprietary blend of these ingredients that is working together? But I would say if you really wanted to try something, certainly this has the most evidence. Otherwise, just using a good nourishing moisturizer. If you wanted to do oil massage, go for it. So the next category is hyperpigmentation, darkening of our skin. And this is super common. Up to 90+% of expecting moms will experience some sort of changes with the skin color, whether it's mild and generalized or it could be localized. The common ones that we see are darkening of our nipple, darkening of our body folds, especially if you have more melanin-rich skin to start. In skin of color individuals, we tend to have more darkening of the skin, like around our armpits, where there's more skin redundancy, and certainly that can darken with pregnancy. And a lot of it has to do with the hormonal changes that our body's going through. One thing that almost I feel like all moms get is this dark band going down from your belly button to your lower abdomen. That's called linea nigra. And for me, mine, even though lightened up with my first pregnancy, it never went away completely. And that's 100% normal. And then the other concerns that we get with hyperpigmentation is melasma. Melasma used to be called the mask of pregnancy. About 50 to 70% of women will get melasma during pregnancy. Now, melasma, I'm planning to do a separate video on this because it's so complicated. There are a lot of nuances that goes into it, but understand that there are a lot of components to melasma: hormones, vascular component, inflammatory component, and we also know that ultraviolet radiation, as well as genetics, these all play a huge role in causing melasma, because we know that not every woman gets melasma. Now, certainly melasma tends to occur again in individuals who have darker skin tone, but a lot of women who are more fair skinned will also experience this. And with the hormonal changes, you may actually even see yourself developing more post-inflammatory hyperpigmentation, whether it's from acne or even eczema. And this is where you want to be very, very careful, because our skin is a lot more sensitive, and with all these hormonal changes, potentially more prone to hyperpigmentation. Any products or even elective cosmetic procedures that you choose to undergo, the changes with our skin are somewhat less predictable during pregnancy, and this may put you at higher risk for developing post-inflammatory hyperpigmentation. So if there is anything that you are interested in doing, always speak with your provider first. And certainly sunscreen can be very helpful, whether you struggle from melasma or just post-inflammatory hyperpigmentation with acne or what have you. And I'd be happy to make a video on some of my favorite sunscreens during pregnancy, but just to put it out there, all sunscreens, regardless of their filters, chemical or mineral, are 100% safe to use during pregnancy. Now, the next category of changes that we experience are vascular changes, and that has to do again with hormones, with the fact that as the baby is growing, it's actually physically putting pressure on our veins, causing backup of blood flow and certainly causing vessels to develop and to dilate. Now, about 40% of expecting moms will have varicose veins, commonly on the lower legs, and you can also develop these tiny little bursts of blood vessel that we call spider veins, spider angiomas, because they almost look like little spiders all over our body. I mean, the good news with the spider veins is that 70% of the ones that develop during pregnancy can regress spontaneously after delivery. You can also even get these pink to red little bumps on our skin. They're more hemangiomas or cherryangiomas, and those you can get normally too. It's just benign skin findings. Sometimes with age, genetics can play a huge role. But just remember that blood vessel dilation and new onset of vascular findings on the skin is very, very normal. What you can do to help with the varicose veins is, number one, wear compression stockings. Limit the amount of swelling on the legs because that further can put pressure on the legs and our veins and cause them to dilate. Certainly you can't really have a lot of control about the spider angiomas, but understand that a lot of them can go away, and certainly there are great laser options postpartum for the ones that still persist, and your dermatologist can easily treat them if they are still there. In that vascular category, two other things are less commonly seen, but nevertheless are benign, are what we call Palmar redness, Palmar erythema. Some moms may just, when they look at their palms, like, oh my God, my hands are really red. And that, again, a lot has to do with increased in blood volume and the hormones causing the blood to dilate. And certainly that's normal. And then another benign growth that almost looks like a friable little mushroom or like a little button that can develop on the lip, some get it on their nipple, and it can really occur anywhere on the finger even. Sometimes it can occur after trauma, is a little tumor, benign tumor called Pyogenic Granuloma. And it's like this little pink friable little papule that may bleed like crazy. And sometimes they will come on quickly and then go away, but often they may need more help from your dermatologist. And this is something we can easily remove safely in office if you do experience one of these little suckers. The next set of categories are just sweat gland and oil gland changes that occur during pregnancy. And certainly a lot of women will experience, increase in sweating. There's been studies that suggest that there may be a higher sebum output. And so that is often potentially what is in part causing some of the hormonal changes that we see that leads to acne. Now, again, every pregnancy is different, but I will be making a separate video on how to treat acne during pregnancy. Again, I just want you guys to understand that this is very normal. Every pregnancy is different. Everyone is different. We have, even though limited, but still nevertheless, a lot of great options to help you with your acne. But if your acne is leading to a lot of pain, please follow up with your dermatologist, because there are absolutely things that we can do that's very safe in office to help you. Okay, now let's talk about itching and rashes in the skin, because that certainly is actually one of the most common things aside from acne and stretch marks and melasma that I see in my expecting moms. And I am also experiencing it now, a flare up of my eczema, especially during the first trimester. It's a little bit better now. I just normally tend to get eczema on my neck and on my hip area when I'm stressed, and that certainly I get it kind of throughout the year. But this time around with the pregnancy, I certainly have been experiencing quite a bit of eczema patches on my neck. And eczema, flare up of eczema, whether it's in someone that has a history of eczema or someone that really never had it but is getting it for the first time, is the most common cause of itchy rash in pregnancy. So certainly your dermatologist can be very helpful in treating eczema, and there are a lot of safe things that we can do and prescribe you to help you with your eczema during pregnancy. Along with that, just like the hormonal changes and the immunologic changes that can lead to itching, whether it's dry skin or even hives. As I mentioned earlier, I've been getting a lot of hives on my face. I got that in my first pregnancy and I'm getting it again. There are things you can do, take like antihistamines, which speak with your provider about, but they're very safe during pregnancy. But all these are very, very normal. So the most important thing you can do to really minimize the itching is, first and foremost, just take really good and gentle care of your skin. I have a video all about how to take care of dry, itchy skin, but essentially you want to minimize the soap that you're using. Really just use soap where you need it, or gentle body cleansers, and making sure that when you are in the shower or if you're taking a bath, the water temperature is comfortably warm, not hot, because that can be very dry and irritating. And the key is, within literally a minute after coming out of your bath and shower, pat your skin dry. When your skin is still soft and damp, this is the absolute best time to seal in all that moisture with a good moisturizer. And so really taking those steps in the gentle bathing habits, as well as using a good moisturizer, a lot of the times it can really help with the dry skin and the itching that you may experience, as well as your eczema flare. And then if you've been doing that consistently and you're still breaking out, then please see your dermatologist for a prescription medication. Another common rash that women will get is this articurial eruption during pregnancy. It has a fancy name because most commonly it presents with all sorts of different findings, from little bumps to even vesicles to hive-like lesions, and classically will start, as I mentioned earlier, in the third trimester in the stretch marks of our belly, and it's extremely extremely itchy and can even move down to the thigh, sometimes to the breast. Understand that if you do end up getting it, it's very uncomfortable. It may seem like something really bad is happening, but this is very benign. There's nothing that is harming the baby. And a lot of the times your dermatologist or your OB will just help you to get through your symptoms, and often delivering the baby is really going to be key. Okay, now let's quickly jump into hair and nail changes. So hair changes, fortunately during pregnancy, a lot of us tend to retain our hair because everything is in that growing phase. A lot of women will notice that their hair has more volume, there's less shedding. So people kind of tend to say that pregnancy glow and voluminous hair. So certainly that is something that, if you have, please enjoy, because certainly most women will experience this temporary hair loss that's called postpartum telogen fluvium. Usually starts 3 to 4 months postpartum. And that just has to do with the fact that during pregnancy, everything is in that growing phase. So there's less hair shedding. And then when you deliver the baby, your body is just reverting back to what is normal. So it may seem like you're shedding a lot more hair when really previously you weren't shedding as much. And so that temporary shedding during postpartum is temporary, but there are things that we can do to help you, and happy to make another video on hair loss postpartum if you guys are interested. Now, another thing that some women will experience is actually excessive hair growth, often seen in people who have more like body hair to begin with, or those individuals who have darker skin tone, as well as even darkening of hair on the body or face. So all of this is very, very normal. Now, lastly, nail changes. One of the things that I've seen, and I certainly feel like a lot of my pregnancy friends have said too, is just how fast your nails and hair grows during pregnancy. A lot of that, again, has to do with hormones, but I also think that certainly being on a prenatal vitamin is helpful in increasing the growth phase. Some of the nail changes that could occur are sometimes what we call like ridging of your nails, so little indentations of your nail. Sometimes your nails can become more brittle. They may split. They may even lift off from the nail bed. Your nails can even like thicken and look like they may have like an infection. You can certainly get inflammation of your cuticles, redness and tenderness. We call that paronychia. All of these changes are normal. Again, if you have concerns, please follow up with your dermatologist. As far as like what you can do if you are experiencing any of these nail concerns is potentially minimize the amount of manicures and pedicures you're getting. So minimizing that can potentially improve the overall health and the thickness and the strength of your nail. Certainly making sure that after each hand wash, you're moisturizing not just your hands, but making sure you extend that moisturizer to your nail as well as the cuticles. And then what I really like is applying a thick layer of petrolatum or some sort of ointment on my nail as well as the cuticles at bedtime before I sleep. And that certainly can help to repair your nail, the cuticles overnight. Alright guys, that is my quick rundown of some of the common skin changes that we see during pregnancy. I will be planning to make a subsequent video on how to take care of your skin, what changes you should be doing during pregnancy, what ingredients to avoid, as well as a video on acne as well as melasma. Certainly if there are other topics you want me to address with regards to skin, hair, nail changes during pregnancy, please comment below and let me know. Again, thank you so much for watching. You can again find me on social media on Instagram and TikTok, and I will see you guys next time. Bye.